Welcome to Facebook Live with Central Vermont Medical Center, where CVMC's medical experts and others answer community questions. For the last few years, Good Beginnings of Central Vermont has collaborated with CVMC and others for its annual Climb Out of Darkness event to raise awareness about perinatal mental health. This year, COVID-19 has changed how the event is done, but also increased the need for awareness it brings, as social distancing and self-isolation hold the potential to exacerbate problematic isolation that families with new babies already experience. Today, I'm joined by members of both CVMC's Women's Health team and folks from Good Beginnings of Central Vermont. With Good Beginnings of Central Vermont team, we have Gretchen Elias, Executive Director, and Loriana Capone, Certified Postpartum Doula. And with the CVMC Women's team, we have Dr. Colleen Haran, gynecologist and obstetrician, Eliza Vandervoort, certified nurse midwife, and Angela Shea, behavioral health clinician. Hi guys, how are you?
Hello.
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 We're live on the Facebooks. And then for those of you following at home, you might be noticing that we're not wearing masks right now. That's because each of us is in our own private spaces. There's nobody else around. We encourage anybody in a public space to observe social distancing and wear masks to prevent the spread of COVID-19. So we're in a little bit of a different situation than those that would be out in public or around a conference room table. So with that, to the group, tell us about some of the challenges that families with new babies typically face, and how has COVID-19 made some of these issues worse or exacerbated them?
I'll start off as, just under normal circumstances, a lot of postpartum families, perinatal families experience some degree of isolation after birth, usually if they're home recovering. So there's always a need for increased support around them. But especially now with distancing that we have to do to stay safe, isolation and loneliness affects families even more. And we need those human connections and supports.
I also think a little bit about the physical and the emotional healing that comes after having a baby, and how sometimes it's nice to have help, whether that be food, whether that be a shower, whether that be a walk. And that's really hard to get now if you're protecting family members or those who are in compromised positions and not being able to be together. So folks are getting creative and having to figure out how to get creative to get the help that they need.
I agree with both Anna and Angela. You send somebody home with a new baby, maybe a lot of discharge instructions, but generally we joke that a new baby doesn't come with a manual on how to take care of it. You're going through physical changes from recovering from birth. You're going through hormonal changes from changing from being pregnant to not. All of a sudden you have immense responsibility for a newborn. Maybe there's older siblings in the home and they have needs as well. You're going through the character of your relationships with your other family members changes, because all of a sudden everything is focused on this newborn. Maybe you're sleeping well, maybe you're not. And our societal expectation is that it's a really happy, blessed time. And it is, but it's also a really difficult and challenging time. So even for healthy, well families, they can really, we use the expression, it takes a village. They can really need help and support. And how do we as a community provide that support, especially in a time when we're recommending social distancing for everyone? And then you add on top of that people who have bona fide perinatal mood and anxiety disorder. So something different from just the stressors of having a baby or the stress or the baby blues or that kind of thing, but somebody who is really struggling. How do we reach out to them so that they don't have to reach out? And I think that that's what we're really looking for how to do as a community in this challenging environment. So.
And so, Gretchen, what's Good Beginnings, what's CVMC doing to tackle some of these new challenges?
Well, so the challenge that Good Beginnings faced is that one of the most valuable things our volunteers were able to offer is to be able to go into the home and provide a physical source of respite to families. So if you needed that nap or that time away from your baby or some time to do self-care, our volunteers could actually go into the home and do that. And one of the biggest challenges that we've been facing is that need hasn't gone away. If anything, it's intensified, and we've had really limited ability to do that safely. Some of the new needs that we've seen that we have been able to address effectively, which I think flow from the pandemic, is we've seen an increase in families reaching out to us with a lot of practical newborn care, postpartum recovery questions, not necessarily questions that a health professional is needed to answer, but, you know, how do I swaddle my baby? Why can't I soothe my baby? You know, a lot of new, sort of practical things that I think a lot of families were previously getting organically from family members who would stop by, friends who had had babies before them. They were able to pick up on that sort of those learned wisdom kinds of things from their networks. And now we're finding an increase in families reaching out to Good Beginnings. And Anna is doing a lot of phone support, and our volunteers are doing a lot of phone support about those kinds of issues. I don't know, Anna, if you'd like to add to that.
Yeah, just I think, and you know, we should also mention our climb, which is going on this week, which is a great way to like plug into something that is going on in the community that we can share with each other and have those connections. And I think that because the social support helps people stay so strong, forcing ourselves out to those virtual groups or asking for help, even though we want to be reaching out to people and offering help as community members. I think it's something that we're trying to raise awareness around of the community coming together around this issue and taking those steps to reach out and call the family. Like, it's amazing how much a phone call can be so connective. And there's, you know, we can do just an old-fashioned check-in, and we run a warm line that I think it's through PSI, and I think has been helpful for some people in calling and checking in, getting a referral to a local trained perinatal mood and anxiety, a clinician to connect with and nurture that connection and follow up with that family to make sure they connect with that clinician and sort of guide them towards a path of treatment. That's a pretty important thing that Good Beginnings and PSI are doing. PSI does all the time, and Good Beginnings is supporting that as well. So, and if there's, I think Angela, maybe you want to share a little about Baby Circle Time and how that's helping families connect.
Sure. So Good Beginnings, the Children's Room of Waterbury, and CVMC are co-facilitating a baby circle, a virtual Zoom support group for both pregnant and postpartum people who would need support. Any kind of caregiver is welcome. And it's on Zoom. And so it's a nice way of sort of meeting folks where they're at. And you've got really beautiful participation. When you think about diabetes, you think about blood pressure, if you need help, you sort of reach out and get that. And mental health, we're not there yet with mental health. And so pre-COVID, it was difficult to do that. And now with COVID, it feels even more difficult to sort of get that connection that you need for mental health or potentially reach out. And the group is a great way to be able to address that. And groups are amazing in that they can run themselves with some really amazing facilitation from our partners. The participants all help each other out, and a lot of really nice common threads where we're all learning from each other. So that's every Wednesday from 12:30 to 1:30, and folks do need to register beforehand.
And what's up in that like been so far? Have people really taken to it? Is attendance good? Or are people really happy with it? Or, you know, are they sort of like, I can't wait to be in person again?
We have about 12 participants, all who have registered. Attendance does vary week to week. And the participants are often commenting that it's difficult to get online. And then once they do, they're really glad that they did. It's work. It's work sometimes to get connected and to make that positive connection. But for the most part, it's been wonderful in the sense of having a topic and a platform to discuss. And it's great having the partnership with each other.
Yeah, it builds community a little bit. Great.
I've definitely observed like the participants supporting each other directly, and there's a lot of Me Too moments, which you can see the tension just drop out of their shoulders when they realize they're truly not alone. So that's powerful for people.
Yeah, that's the community aspect of it, that it's really easy for someone at home alone with a new baby to think that they're the only one who's feeling this way or experiencing this. And so connecting with other new parents or folks who have been through it and hearing that that you're not alone is really powerful. And I think another interesting lesson that the epidemic has shown us is that sometimes not having to do this in person can make it easier to reach out and get help. There's definitely been some folks for whom expanded opportunities to connect via phone or online has actually made it easier for them, because the anxiety that they might have felt around an in-person interaction was actually getting in the way. So it's interesting. It's a complicated dynamic.
You don't have to make an appointment, wrap up the baby, bring them
Yes.
in a waiting
Yes.
room,
Parking.
talk to. It's
none of that.
Yeah.
You can just hop online or call in. You can just use a regular phone and listen. You don't
Yeah.
be on a screen if you don't want to.
Yeah. If you're not ready to show your face yet, you can just listen.
So there are some real convenience pieces to it and convenience elements in terms of being better able to access it. And you guys mentioned community, and obviously community in Vermont, I think, is a really important part of what makes people strong and helps support each other. What about folks that are more familiar with sort of some of the more traditional methods of support of one's neighbors? Like how do community members at large sort of get involved and support families with new babies?
you want to talk about the climb, Gretchen? And Gretchen and Anna have put together some great ideas for being able to support community members, I think, this week. So, and families.
Yeah, so the climb is usually an in-person event. The past 2 years, we've held it on the State House lawn. Around 100 people have shown up each year to show support for families who have experienced perinatal mood and anxiety disorders. And the intent of the climb has really been to that visibility piece, that getting to have a visible statement of community. And for obvious reasons, we decided that was not possible this year. And so we've moved the climb virtually, and it kicked off yesterday. It's a week-long event this year, from yesterday until Saturday. And we're putting out a whole range of ways that you can help members of your community who might be experiencing isolation, new parents, but not just new parents. We wanted to really connect it to COVID and the fact that there's a lot of folks who are potentially struggling with isolation as a result of COVID. So a lot of what we're putting out there, while we're emphasizing new parents and the mental health of new parents, a lot of the practical things that we're suggesting are relevant to anyone who might be feeling isolated. So you can follow the Facebook event and our Facebook page. We have some games, some things to make it fun. We have 2 versions of bingo, a self-care bingo and a community care bingo, that we're encouraging folks to go and download those cards from our Facebook page and play along this week. If you submit your completed card by Saturday, you'll be entered in a drawing for a gift certificate from a local business. And you can do both, or you can just do one. The self-care one is obviously focused on concrete things you can do for your own mental health and wellness. And the community care one is a whole bunch of great ways that are easy and free that you could reach out and support someone else who might be isolated in your community. We are also still encouraging folks to stand up and be counted as folks who, as members of the community who support families with new babies. And you can do that by joining our team on CauseVox, which is really easy and no fundraising is required. And you can also do that by going on your own physically distanced climb. this week, which could be anything from a walk around the block to a jump on the trampoline in your backyard to a hike up Camel's Hump, if that's, you know, how ambitious you are, and take a picture of yourself on that walk or climb or stroll, and send it to us. And we are going to have a group photo this year. Instead of on the State House steps, it's going to be a collage of everyone who went out and climbed in honor of their own or someone else's experience with the perinatal mood and anxiety disorder. So those are some of the things that we're doing. I don't know, Anna, if I forgot anything.
We have, in addition to all that really fun stuff, it just gets me excited thinking about it. I love the thought of getting my kids involved in the bingo part. Like, Mom, it's time for you to put lotion on yourself. But I was also going to mention, we also have kind of a scavenger hunt going on throughout our county. On local businesses. Some of local businesses locally have been putting up our community care and informational posters about perinatal mood and anxiety disorders that include great ideas about how to reach out and support families with new babies and anyone during this time. So you can also take your picture and text it or tag us of you with some of those posters too, visiting places, local businesses, and maybe supporting them. So
yeah, look for those purple posters. I think
So in terms of the purple posters, would you be revealing too much if you said, is it just in Montpelier? Is it Montpelier Berry?
Oh no, I think we were successful in getting posters up in nearly every community in Washington County that Good Beginnings serves, and also 3 or 4 Northern Orange County communities. So that would not be revealing too much. People have plenty of opportunities to find those posters.
That's a wide range. Okay. And then we did get a question from somebody on Facebook. Evan asked, how do women register? And I'm assuming he's actually asking about the mom baby circle time.
Correct. Yeah.
So how do people register for that?
So folks can register either calling Women's Health Office and getting connected to Angela Shea. Registration is coming through our office at CVMC Women's Health. And my email is angela.shea@cvmc.org. And the Women's Health line is 802-371-5961.
Awesome. Perfect. Okay. So, if people should definitely reach out, register. It's a great way to connect and feel supported and engage with your community and share sort of what's happening in your life and hear what's happening in other people's lives. That's fantastic. Are there other places people can go for resources? Good Beginnings website or something like that, if they have sort of additional resource needs?
Yes, our website has a great organized list of needs of resources for expectant parents and new parents. And we've updated that to make sure they're relevant currently with COVID in terms of how resources might have changed and what resources are available to meet new needs with respect to COVID. So there's a lot there. We also have a family newsletter if folks want to have sort of emails sent to them monthly or so with resources and suggestions for ways to connect and ways to engage with their community. We encourage families to sign up for that newsletter as well.
And another great outlet for general resources for families is the Help Me Grow line through the 211 number.
Yeah.
211 Help Me Grow. Okay.
Yep.
And we got another question. This one says, what is the difference between postpartum depression and perinatal mental health?
That's a great question. I can try to field that a little bit. People have, I think, some understanding of what postpartum depression is, or people may think that they have an understanding of what it is, and it sounds like something really scary, and it's sometimes equated with some postpartum psychosis and some media stories, and oftentimes people feel like, well, that's not me. That's not what I'm going through. And I think that people have, I think both providers and physicians, obstetricians, gynecologists in particular, may have in the past had a hard time knowing how to screen people for postpartum depression or for perinatal mood and anxiety disorders. So I think the best way to explain it is it's not just depression and it's not just postpartum, but a lot of people start to experience mood disorders even while they're pregnant. And certainly in the postpartum period, again, you're going through that physical healing and you're going through some hormonal fluctuations, both while pregnant and after delivery. And for a lot of people, it's the anxiety component that is more what they're feeling than the depression component. And there's a level of that anxiety that is normal and adaptive for being a new mom. You're going to be mama bear and you're going to be looking out for danger. It's in our reproductive interest to look out for dangers that might visit themselves among our offspring. And that's good. We probably take better care of ourselves when we're pregnant than we do in other circumstances. A lot of women go into recovery from drug and alcohol abuse when they're pregnant. And then when you deliver, you have this new little baby and you're on the lookout for any kind of danger, and that might be good. But when that evolves into an anxiety that is, that becomes, that you can't function around it because you're constantly scared, or you're afraid that you're going to drop the baby, or you're afraid that, of going places. And then here we are, we're a lot of times predisposed to this anxiety. And then we have COVID on top of that. So we're looking at the news and people are saying, be careful, wear a mask, don't go anywhere. So you're taking that anxiety, which might be, is it new parent anxiety that's normal, or are you experiencing it to a level that is interfering with your function, and is, the news and the rest of the world actually helping, exacerbating that for you? And how do you get help for that when you don't want to say, well, I don't have postpartum depression, I'm not going to hurt myself, I'm not going to hurt my baby, that's not what my experience is, but I'm really suffering and I'm really struggling to find my way in this new identity. So I think there's a range of experiences, and it's not just something that happens postpartum, and it's not just depression.
Yeah, the range of experiences. I just had a couple of thoughts in addition, Colleen, sorry.
Sure,
but the range of experiences is so important. And I think that's part of the why we try to talk about mental health rather than postpartum depression, because as a new parent, your mental health is important, and no matter what kind of experience you're having with your mental health, it's important that you get support around that. And then we use perinatal because, and this I speak from personal experience, some people think that whatever mood and anxiety problems that you might experience would only happen in the first 3 months after you have a baby. And in reality, you can experience them during pregnancy and up to a year afterwards. And again, I know that I struggled for a full year after my first baby. So that's a particularly important point for me. Sorry, Colleen.
No, but that's fantastic. That's great.
And it's something as clinicians and as a clinician team and community here that we're really screening women for every time we see them. So anytime we see somebody in our practice, whether it's for an annual exam or a pregnant person, it's part of our routine screening to check in because we're aware of the impact that untreated mental health issues have on health outcomes. And we're all at risk. So part of our role is really normalizing it for the people that we take care of and for those around them. So when we're seeing somebody, as we do most days upstairs, who have just welcomed a baby into their lives, and we're seeing these new parents, we're normalizing these changes as they're heading home and going out the door, things to watch for. This is really normal. Expect it. We have lots of great resources. These are some things that would raise my concern. Here's some ways to protect. So just really doing that counseling. Yes, at the time after delivery, but also our whole prenatal care course. We're incredibly lucky, I think, for the resources that we have in our community to really link people. Our in-house therapists, phenomenal nurses, the team at Good Beginnings, but all across the community to ensure that folks that get flagged get help. And connecting, pregnancy is a time where luckily in Vermont, folks have health insurance, and it is a time that we can get them connected with primary care resources as well. So that's the other piece as well for many of the folks that we care for that otherwise might not have primary care providers. It's really a chance for us to make those linkages and ensure that if once they're done with their sort of pregnancy related care, that we're able to ensure that they're in good hands moving forward. So.
You know what, I just want to add to, Lisa's statement in terms of screening people at every visit. And I think we're doing much better than we used to do with screening. And I'm sure we have a long way to go, but we used to have a little bit of a don't ask, don't tell policy towards postpartum depression or perinatal mood and anxiety disorders. So you would have a person who might be struggling and not want to say that they're struggling because they're ashamed of the thoughts or feelings that they're having. And then you might have a provider or a physician who doesn't quite have the confidence to ask or to screen because might not be my expertise as an obstetrician to treat somebody's mental health. And I might be a little bit intimidated. And do I want to have somebody, go to the emergency room or be stuck on a waiting list or have some kind of non-satisfactory experience in terms of, when you talk about screening for something, you want to screen for something that you can offer a solution to, not just be like, well, sorry, I diagnosed that, but on to the next thing now. And I just want to speak to that over the past 5 years, having our community health team integrated into our women's health office here at CVMC has just been transformative in terms of improving our confidence in screening and improving our ability to get people the help that they need, because we can do a warm handoff. It's a little bit different now with COVID. It might be more of a virtual warm handoff, but there's a big difference between saying, you should maybe call somebody and let's see if we can get you a therapist, and saying, I want you to meet Angela. She's right here down the hall and she's going to have some time for you. And when we initially brought mental health professionals into our office, it was really about substance abuse screening, which was great. But then we started quickly to utilize them when we identified people with specifically postpartum depression, which was probably all we were looking for at that time. And I think we kind of moved on, correct me if I'm wrong, Angela, but we moved on from, have them see the people that seem to have a postpartum mood disorder, to maybe it would be better, maybe we're not identifying everybody. Maybe we should have everybody meet with the community health team and meet with Angela or or Hillary, her colleague. And then we pushed it back a step further and we were like, wow, this person had some risk factors that could have been identified if we had seen them while they were pregnant. Maybe we should have people who are at risk see our counselors while they're already pregnant or while they're still pregnant. And then we moved it back to maybe everybody should see our counselors while they're pregnant, and everybody should have speaking to what Elisa said in terms of expect this. This isn't something that happens if something's wrong with you, but this is a challenging time. And what are you going to do? How are you going to handle it? Who are going to be your supports? And I think even more so now with COVID, saying to people like, you don't have to come in, but we can get you a video visit. We can have somebody call and check in with you. Is it okay if I have someone call, and really make it like more of a normalized, like we expect everybody to need someone to talk to. And this is a part of your care. This is not something that stigmatizes you. This is not something that you only need if you're going to be an unfit parent. This is, something for everyone. So I think we've come a long way, and I'm sure we've got a long way to go. But again, having the community and being able to, again, plug people into Angela, plug people into Good Beginnings, that it's not just one person. It's not just your obstetrician that is going to help you with this, but that it's really a team approach. So.
Well, it sounds like an incredible evolution and just incredible teams within CVMC and within Good Beginnings, ready to really support new families as they embark on a new stage of their life, and that's really impressive. I think, as you all stated, folks that are interested in participating in Baby Circle Time, that happens when?
Wednesdays, 12:30 to 1:30.
Great, and it's by registration. You can register by giving us a call, and or send you an email, right, Angela?
Correct.
And Climb Out of Darkness is going on this week. When does it end, Gretchen?
Saturday.
It ends Saturday, so folks should, take their own climb, Oriana, you can probably do a better job plugging it than I can. Oh, you're on mute though, so no, you can't.
It's a choose your own adventure, and stand up and be counted in your community, in your village. We have a great village here with all these wonderful organizations, our medical center supporting this event. So there's so many fun things to do all over the state. So get out there and find something, or just go in your backyard and jump around like Gretchen said. So anything goes.
Great, fantastic. Thank you all so much for joining us today and letting people know about what's available to them in their own community to support them. It's great. We really appreciate it.
Thank you.
Thank you.
Thank you.
Thank you.
Thanks for having us.